Hi, I'm Josh
I'm Gabe.
from Balance Buddy Rehab. Today, Gabe and I want to show you a very specific stretch of some front neck muscles called the scalenes. A lot of times people have a tendency to drop their right shoulder down, which can make the neck deviate back to this side. And they tend to use the scalene muscles. It's muscles on the front of the neck here that run from the front of the neck to the first and second ribs here. They tend to use the scalene muscles to reorient them to get their neck back this way. And they'll also tend to chest breathe, which uses those muscles as well to make those muscles tight. So we want to teach you how to loosen those up, and that can rid you with that can help you out with a lot of left neck pain that you may have there or other problems throughout the area. All right, the way we stretch those, Gabe, let's have you sit on your left hand. What we're doing there is holding that left shoulder down because it has a tendency to raise up. So he's sitting on the left hand, he's having an awareness of keeping the left shoulder down as he tends to lean his head back and to the right. He's not just leaning his head to the right, he's moving it away from himself too. And he's leaning to the right, and then he's going to twist to the left here to kind of look up towards the ceiling to get a stretch in those muscles. He's looking for a stretch in his left neck right through here. We tend to have people hold that for 30 seconds while doing some deep breaths and then doing that a couple times. There's different ways you can do a contract relax on this as well to get a different stretch. So Gabe, take your right hand and put it on top of your head there and pull your head back that way. Good, so he's getting a more of a pull of a stretch, it's a little more aggressive. And then he can try to take his head and try to push his head into his hand a little bit, hold, and then relax. And then he takes the head a little bit further to get more of a stretch. By contracting the muscle and then relaxing, it helps allow him to have a further stretch there. Wonderful. And so he would do a contract, relax, hold it for a few seconds, do that a series of 3 times to get the relaxation desired. You try either way, whichever one gives you better results, then use that strategy. You can also stretch the right scalenes, but I'd ask your clinician whether or not that's a good fit for you. If it feels okay, then go ahead and do that. But majority of the time, it's the left scalenes that are tight. Hope this helps.